Hello everyone, my name is Brittany Hackler. I'm an LPN to BSN student at Indiana State University. I am currently taking Nurse 444 Community Health Nursing for the spring 2022 semester. This is my first community health nursing project and the topic is diabetes mellitus, a brief overview of risk factors, prevention, and treatment. Populations at risk. The minority populations at risk are African Americans, Hispanic Latino Americans, American Indians, some Asian Americans, and Native Hawaiians. The learning objectives for this presentation are: the viewer will be able to define diabetes mellitus. The viewer will be able to summarize the body systems involved with diabetes mellitus. The viewer will be able to distinguish risk factors that lead to diabetes mellitus. The viewer will be able to recall signs and symptoms of diabetes mellitus. The viewer will be able to recognize interventions for control of diabetes mellitus. The viewer will be able to explain diabetes mellitus risk factors, symptoms, and interventions. At this time, if you don't mind, please take a moment to pause this presentation and take the pre-quiz. The link is located below in the video description, or copy and paste the link on this slide in your internet browser. Okay, let's get back to the presentation and see how everyone did on the pre-quiz. Pre-quiz answers. The first question is, what is more common, type 1 diabetes or type 2 diabetes? If you chose type 2 diabetes, that answer is correct. The second question is, in general, can type 2 diabetes be prevented? Yes or no? If you chose yes, that answer is correct. The third question is, eating too much sugar causes diabetes. True or false? If you chose false, that answer is correct. Explanation of answers. Type 2 diabetes can be prevented if an individual has a healthy lifestyle. Type 2 diabetes is more common due to unhealthy lifestyle choices an individual makes. Another myth is that eating too much sugar causes diabetes. Eating too much sugar does not cause type 2 diabetes. Later in this presentation, risk factors to diabetes will be discussed. Statistics. In adults, type 2 diabetes accounts for approximately 90 to 95% of all diagnosed cases of diabetes. There are 34.2 million people who have diabetes. 1 in every 10 people and 1 in 5 people don't know they have diabetes. Risk of early death for adults with diabetes is 60% than for adults without diabetes. Total medical costs and lost wages for people with diagnosed diabetes is $327 billion. Medical costs for people with diabetes are more than twice as high as for people without diabetes. What is diabetes mellitus? Diabetes mellitus is when your body produces little or no insulin. Insulin, which is a hormone, is released by the pancreas in response to sugars in the blood. Diabetes mellitus can cause serious health problems and there is no cure. There are 3 main types of diabetes. The first is type 1 diabetes, the second is type 2 diabetes, and the third is gestational diabetes. The risk factors for diabetes mellitus are having a family history, having a BMI above 23, which means you're overweight, being over the age of 40, having a history of gestational diabetes, having high blood pressure, sedentary lifestyle, having abnormal blood cholesterol or lipid levels, having impaired glucose tolerance or fasting glucose. Now, sedentary lifestyle can contribute to all of these factors. And when you're over the age of 40, being sedentary puts you at even greater risk of developing diabetes. The body systems that are affected by type 2 diabetes. The brain. Damage to the small blood vessels in the brain affects the brain's white matter, which can cause a stroke. The heart. If you have diabetes, you're twice as likely to have heart disease. The peripheral arteries in the body. PAD, or peripheral artery disease, is often the first sign that a person with diabetes has cardiovascular disease. The eyes. Diabetes can damage your eyes over time and cause vision loss, even blindness. The kidneys. High blood sugar from diabetes can damage blood vessels in the kidneys as well as nephrons, so they don't work as well as they should. Your feet. Increased risk for ulcers and damage to the feet. Signs and symptoms of someone who is suffering from type 2 diabetes or who has type 2 diabetes. Increased thirst, increased hunger, frequent urination, visual impairment, fatigue, tingling hands and feet, weight loss, or poor wound healing. Managing and preventing type 2 diabetes. There are 3 methods to help prevent the development of type 2 diabetes. The first is eating healthy. Eating healthy is the key to managing blood sugar. The second is keep a healthy weight. Physical activity can make you feel better, function better, and sleep better. Educate self. Programs such as Diabetes Self-Management Education and Support Services help people with diabetes learn how to take the best care of themselves. There are 3 treatment methods that can be utilized to help with type 2 diabetes. The first is taking medication. Taking medicine as instructed is very important. Administering insulin. Administering insulin at appropriate times. And this sometimes is based on your blood sugar, whether you are going to take insulin or whether you're not going to take insulin. And the third is, of course, monitoring blood sugar. It is important to keep your blood sugar levels in your target range as much as possible to help prevent or delay long-term serious health problems, such as heart disease, vision loss, and kidney disease. Resources. When you're trying to find resources on type 2 diabetes, it is important to find websites that have accurate information. Not every website that you read has accurate information. The 4 websites that I have presented here are Center for Disease Control and Prevention Diabetes Prevention, American Diabetes Association, Mayo Clinic Diabetes Diet, Center for Disease Control and Prevention Exercise Plan. These 4 websites have accurate information and will help you steer you in the right direction on different diet restrictions, exercise plans that may fit into your daily activities, and just general information about type 2 diabetes and other types of diabetes. References. The references that I chose for this presentation were American Diabetes Association, Centers for Disease Control and Prevention, the Mayo Clinic Diabetes Diet, and SlideGo for the diabetes infographics. I also utilized fppt.com for the PowerPoint presentation layout. Thank you for viewing this presentation. After this slide, please take a moment to take the post quiz. The link is located below in the video description, or copy and paste the link on this slide on your internet browser. Thank you again.